Understanding injection needle sizes. Welcome to today's TRT Juice episode, where we explore an essential aspect of medical practice: injection needle sizes. Whether you're a healthcare professional, a patient, or simply curious about medical procedures, understanding the intricacies of needle sizes can significantly impact the effectiveness and comfort of medical treatments. Why needle size matters. Let's start with why needle size is crucial. The size of the needle affects several key factors in medical injections. Firstly, it determines how easily and effectively medications can be delivered into the body. A needle that is too small may clog or slow down the injection process, while one that is too large can cause unnecessary discomfort and tissue damage. Anatomy of a needle. A typical injection needle consists of three main parts: the gauge, length, and tip design. The gauge refers to the diameter of the needle shaft. It is denoted by a number, such as 18 gauge or 27 gauge, where a lower number indicates a larger diameter. The length of the needle varies depending on the injection site and depth required for proper medication delivery. The tip design can be beveled or cut, influencing how the needle penetrates the skin and underlying tissue. Understanding needle gauge. Let's dive deeper into needle gauge. The gauge of a needle affects its flow rate and the force required to penetrate the skin and tissue. A higher gauge number means a smaller diameter needle, which is generally associated with less discomfort during injections. For example, insulin syringes often use higher gauge needles like 30 gauge or higher due to their thinner diameters, making them less painful for diabetic patients who require frequent injections. Conversely, lower gauge needles, like 18 gauge or 19 gauge, are thicker and are typically used for thicker medications or fluids that require faster administration, such as certain intravenous therapies or drawing blood samples. Choosing the right needle length. Next, let's discuss needle length. Needle lengths vary based on the injection site and the depth of tissue penetration required for proper medication administration. For example, intramuscular injections, which deliver medication directly into muscle tissue, typically require longer needles ranging from 1 to 3 inches to ensure the medication reaches the intended target. In contrast, subcutaneous injections, which are administered into the fatty tissue just beneath the skin, use shorter needles, usually less than 1 inch, to minimize discomfort and reduce the risk of hitting deeper structures. Practical considerations. When selecting a needle size, healthcare professionals consider various factors, including the viscosity of the medication, patient comfort, and the specific injection technique required. It's essential to match the needle size precisely to the medication and the patient's anatomy to ensure safe and effective administration. Safety and best practices. Lastly, safety is paramount when using needles. Proper disposal of needles to prevent needle stick injuries and infections, as well as adherence to infection control protocols, are critical aspects of healthcare practice. Healthcare providers receive training on proper needle handling techniques to minimize risks to both themselves and their patients. Understanding injection needle sizes is fundamental to providing safe, effective, and comfortable medical care. Whether you're a healthcare provider or a patient, knowing how needle gauge, length, and design impact injections can help improve treatment outcomes and overall patient experience. Thank you for joining us today. Stay tuned for more insights into healthcare practices and innovations on our next episode. If you found today's episode informative, please subscribe to our podcast or visit our blog at trtjuice.com for more TRT information. Feel free to reach out with any questions or topics you'd like us to cover in future episodes. Until next time, stay informed and stay healthy.